IOP in various conditions. So today my topic of presentation is about diaphragmatic breathing and mindfulness. So just wait. So this presentation is basically for the just not sake of just to talk about the diaphragmatic breathing, but also for the mindfulness in the stressful condition which we have today, that is COVID-19. From last 6 to 7 months, we are affected with this, and there are so many stressful conditions we are going on, and also work from home and so other difficult condition the family members are also going on. So I want to discuss about something related to that. So first we'll discuss about the diaphragm and its biomechanics and basic anatomy. Then I go through the stress and anatomy nervous system. Then I will discuss about the relaxation response, what is mindfulness breathing, then I will discuss. And then we will have a brief session for the mindfulness breathing. So diaphragm is basically a muscle which is a primary muscle for the respiration, and it's having basically two parts, peripheral muscle and central tendon. So if you see the diaphragm, it's just a flat muscle. If you remove it, that just is just a flat flat muscle which having a central zone which attached from the periphery through the sternum and the ribs, which we'll see later on in the slides. The peripheral muscle, when contracted, they pull the central tendon up downward, so that the lungs having a negative pressure, which will helps to inhale the air. Okay. The peripheral muscle, basically, there are many radial muscle fibers which originating on the ribs, sternum, and spine that converge on the central tendon. The central tendon then make a flat aponeurosis made of the dense collagen fibers. It acts as a tough insertion point of the muscle. The central tendon, basically this is just a draw diagram which shows the dome shape of this muscle and which is attached to the aponeurosis and the various multifidus muscle at the spine. The central tendon, basically over which the lungs is situated, okay, and all lungs and the heart is situated, and which has act as the supporting from the thorax to the abdominal cavity. So this is another diagrammatic presentation. The muscle which is a dome shape, and it's having foramina for esophagus and the vena cava, also for the aorta. The esophagus through which the wind pipe, also the wind pipes which passes through. Sorry. So the xiphoid process, the sternal and the ribs, the attachments are going to merge and form the aponeurosis, which moves downwards to gain the air inside the lungs. So this is how the lungs situated, and the diaphragm, which is shown here in the black diagonal color, and it separates the thoracic cavity from the abdomen. So whenever we inhale, the diaphragm flattened out, and we inhale the air. So this is just a diagrammatic presentation which shows how the muscle is working, and this central tendon is pulled inferiorly so that the lungs get the negative pressure through which the air is pulled inside. The expiration is basically passive process because of the lung collagen elasticity. The air is basically expired passively. Okay? The inspiration is basically a active process. The primary muscle is diaphragm and other muscles. Other accessory muscles are also working, but they are working with the working in condition of stressful or exertive breathlessness conditions. So this is another diagram which shows how this diaphragm working and the abdominal breathing particularly work more. Abdominal movements will be more during the specifically if you are contracting to the concentrated to the diaphragmatic muscle contraction. So this creates basically superior to inferior diameter will be more when we inhale through our diaphragm. So the biomechanically, basically the pump handle and bucket handle movement, you would have heard about that. So pump handle movement basically draw the ribs outward, which will help to to increase the lung volumes and capacity of the lung, which will create a negative pressure and pull the air inside the lung. Now, what diaphragm do basically? So I've talked about that. That is a basic primary muscle. It differentiate from the thoracic cavity to the abdomen, and this is a basically a it also initiates a by which the core muscles are also acting properly. So you can see this diagram where the all throughout the pressure from the superior, inferior, and from the anterior and posterior aspects, the core muscles are working like abdomen and multifidus. From the superior, the diaphragm, which make this pressure, and from the pelvic floor, which also from the inferiorly create a pressure, so that during our musculoskeletal work, this workout will be for the musculoskeletal workout, the basic core stabilization will be provided from these core muscles. So intra-abdominal pressure, in coordination with the core musculature, they stabilize the spine, so that you can have a proper energy transfer during the workouts. It also stimulates the vagus nerve during the during the diaphragmatic movements. If you do properly the concentrated activity of the diaphragm, the parasympathetic drive of the diaphragm will be initiated. Now we'll discuss about the stress. Now in this COVID-19 situation, you must have come up with this condition of stress in cases of lockdown. So many things are closed up, some job losses are there. So the people are going into the OPDs are also not going up to the mark. So this stressful condition basically arises. Basically, this stress is bodily reaction to any change that require an adjustment or response. So just like if you see some rope is keeping over the road, so sometimes it look like a snake, but if you just a panic situation, in a panic situation, you just stress and fight response will be there, and you will flight from there. So it's just a physical, mental, and emotional response of the body. Stress is our normal day-to-day life response. Some are greater adapted to that, some are not. The greatest stressors are like perceived stress, challenges. Challenges means like sports or some games which play with our batchmates or our friends. Sometimes that create a stress. Sometimes it's good or sometimes not. The environment, like typhoon or some pandemic, like presently we are going through, the environment also play a role which give us inner stress. Thoughts, what we thought we are negative, positive thoughts, basically sometimes unnecessary thought which lead to stress to our body. Then physical obstacles, various physical obstacles we face. Our body also, sometimes during the musculoskeletal injuries like fractures or disability, which may lead to a particular stressor. Now psychological barriers are also there, means loss of some family member or various aspects which give emotional trauma. So that also creates a psychological barrier to us. So these are some stressors which are working uh, through our day-to-day life. Now there are two types of stress basically, eustress and distress. So the eustress is basically it motivates us. This is a good stress basically. Like you are going for some interview or giving some presentation or some basically fighting for some game or sports like activity which give the positive result. Uh, it's basically short term without any coping abilities, and it improves the performance. If you have this type of stress, you will work well. Then second type of stress is distress basically. If you're thinking of unnecessary things, different aspects are there which causes anxiety and concern. It's maybe short term or long term. It's basically outs of our coping abilities. It decreases the performance basically. If you're working for something and you think of some different aspect of family problems or the disease or something, so you might have reduces your performance. This pandemic situation, you have this stress of various responses you are feeling nowadays. Now, this body deals with the stress in the way of nervous system. That is the part of nervous system that is called autonomic nervous system. That is classified under sympathetic nervous system. That is fight or flight response. Enteric nervous system. That is gut brain. Basically, via the you vagus nerve. That parasympathetic nervous system, rest and digest response is also there. So these three are basically the classification of autonomic nervous system. The sympathetic nervous system just work opposite to that, means is give rise to a fight or flight response. If any threat comes to you, so for example, an attack or harmful event, it lead to stimulation to brain, that is the part of brain that is called amygdala or hypothalamus, which ultimately gives the signals to pituitary gland and releases the ACH hormone. Then it leads to stimulation of, give rise to a release of cortisol, and at, at the end, adrenaline is released. So fight or flight response is developed in this sympathetic response. Okay. So physiological effects are of the sympathetic nervous system are you must have read all these things, but just we will brush through that. It increases the heart rate, blood pressure, respiratory rate increases, digestion is also slow or stops. There is sweating, the spending of it lead to so respiration rate increases, sweating, sending extra blood to the muscle whenever, because if you need to fight and flight response, so immediately a vasodilation occurs to the muscles and sorry the arterial muscles, and that lead to extra blood to the musculature supply. The pupillary response is also there. The tunnel vision and dilated pupils will be found, and infusion of glucose so that you can have a quick boost of response. The long-term effect of SNS will be weight gain or loss, fatigue, muscle tension, problem in sleeping, digestive issues, poor bowel movements, sexual difficulties, decreased recovery and regeneration, and compromised immune function. So it also affects our immune functions. Now, how does the stress affects the breathing? So basically, what is breathing? We have learned about the biomechanical response. That is how these breathing patterns are there. So we have pump handle and bucket handle movements by which the negative pressure is generated and active inhalation is done, and the exhalation is done through the passive process. Respiratory muscles and joints are also working throughout. The biomechanical response is basically a gas exchange, that is carbon dioxide and oxygen, which is passing through the cardiopulmonary membrane, the alveolar capillary membrane. Physiological response is also there, like emotions and sense of control, conditioned behavior. So all these having affects our breathing rate. Heart rate variability, basically this is a good tool to assess the vagal tone. If you have higher heart rate variability response, that will be having a good, having a good parasympathetic vagal tone. Now the stress, basically in lockdown situation, you are working from home, and that can lead to different changes in your doing the work from the home. So it may be changes to various aspects, like biomechanical prolonged non-optimal posture you are adapting, like this in this image, stoop postures, various flexed thoracic spine, and you are doing a work on laptop, on bed, so that lead to the lung volumes are a little bit affected. Biomechanical, the person may be hyperventilate because of that, unconsciously also. Psychophysiological response is also there, that is outside our control. Decrease our ability to rest and digest, and it also affects our immunity. A biomechanical response can lead to various pains, musculoskeletal pains like uh, trapezitis, cervicogenic headache, like shoulder pain or radiculating pain. So that can lead to various musculoskeletal pain syndromes, trigger points generation. So you must have feel during your work from home. A stress response can lead to various pulmonary response like chest breathing. So a person may not use his diaphragm optimally. So the person is using more of the chest muscle, accessory muscle, because of the shallow breathing, short breathing. Breath holding will be also there. He will unaware of that. Whenever he do some activity, he will just hold the breath. Basically, expiratory time is reduced. Basically. So like breathing in, breathing out, the breathing in time may be more. So I ratio may be disrupted. The normal ratio is 1:2. It may be 1:1 or sometimes the breath hold may be there. So it is just unconscious or be unaware of the things. Now breathing dysfunctions may lead to musculoskeletal problems like poor posture, shoulder pain, neck pain, TMJ dysfunctions. Uh, there are others also like cervicogenic headaches. These are very common. Breathing dysfunctions and stress can cause, they are related to that only. Sometimes stress can cause dyspnea, breathing dysfunction, or breathing dysfunction can lead to stress. So like in some pandemic situation like COVID, the person may feel breathlessness during this disease and he feel more stress. Along with that, there are stress like family isolation and all these things. It can aggravate the stress. So this dysfunction is mainly found in almost 60% of the active individuals. And the contributing factors like movement dysfunction, decreased pain threshold, impaired motor control and balance because of lack of exercises, decreases the productivity, performance, and quality of life of the individual. What is the relaxation response? We'll deal with this. Now our parasympathetic system basically work for this, and that regulates for the feed and breed or stress and digest. It is essential for our long-term survival. Okay, so it is feed and breed is basically whenever we take a meal and we feel relaxed basically, and breed. So that usually give us relaxation. So that words are used for feed and breed on stress and digest. Am I audible? Am I
Yes,
audible?
Yes, Dr. Vaibhav, you are audible.
Okay, okay.
You can
So the
continue.
vagus nerve is basically a prime nerve, which is a prime nerve of parasympathetic nervous system. It is the longest cranial nerve. Remember this cranial nerve. The vertebral nerve is basically a sciatic nerve, which is the longest. But here the cranial nerve, number 10, is the longest nerve of our body. The vagus nerve have fibers that innervates virtually all to our internal organs. From the brain towards the to the neck, it pierces diaphragm and goes and supply to most of the internal organs. So it's having impact on gut-brain reflex. Basically, whenever you emotion or having intense mental distress, our gut may be upset. You may have feel all these things. It initiates your body relaxation response. Basically, whenever I just told you that diaphragmatic breathing can lead to a relaxation response. So it has been researchly proved that by doing diaphragmatic breathing, the body relaxation response can be influenced. So vagus nerve basically influences the relaxation response via the hormones and neurotransmitter for feed and breed and stress and digest. Respiratory system releases the neurotransmitter called acetylcholine, which also helps to reduce the breath rate. Cardiovascular, it controls the heart rate and slow downs the pulse, and also communicate to the gut-brain response. Now, other parts of the body also having these responses like liver, brain, mouth, blood vessels, inflammation. Inflammation, very important to discuss because it suppresses the inflammation via the cholinergic and anti-inflammatory pathways. So, if we have more of the relaxation response or parasympathetic response, so we can lead to a good immunity. So now we'll discuss on the stress reduction strategy. So that is basically there are various types of stress reduction strategy you must have read in your curriculum, like yoga, tai chi, meditation, mindfulness, exercises. Exercises also, after the exercises you will feel the relaxation because of the parasympathetic boost. Diaphragmatic breathing, stress acknowledgement. Stress acknowledgement is basically you acknowledge the stress, whatever you have, and you have to adjust that. So you have to acknowledge that type of stress, and you cannot change that situation. Guided imaginary, basically it's a type of technique by which you just imagine the good time you have, you feel and imagine by closing your eyes in a relaxed situation, and that creates a relaxation response to your body. Body scan, basically this usually use, body scan is a modern word, but in Shavasana, in our yoga term, it has been used since long. Like you feel various parts of the body, like your finger, elbow, shoulder. Then you concentrate on your chest, eyebrows, like that. So different parts of the body are scanned out, and that creates a thought process to be concentrated towards something different aspects of your body, so your stress will be reduced. Then PMR, that's progressive muscle relaxation or Jacobson technique. This is also one of the technique, but it usually for the musculature, that in which you contract strongly and relaxes. That helps to reduce your blood pressure and stress. But here we discuss about diaphragmatic breathing. That is most effective way to stimulate the vagal nerve, because it passes through and pierces and goes towards the abdominal organs. So it stimulates the vagal nerve. It is activating the parasympathetic nervous system, and it helps to create a state of rest and calm. Now, diaphragmatic breathing, and this is the basic tool by which you can generate mindfulness also. So we'll have a session at the end, which I will combine with diaphragmatic breathing session and mindfulness. Now, what is mindfulness? Basically, this is another tool which I have discussed just. So mindfulness is basically defined by Yoga International. Is mindfulness can be defined as informal practice of present moment awareness that can be applied to any waking situation. Any type of waking situation, if you are aware, your body is aware for that, your mind, what going through in your body, like pain. If you have pain, then you thought for that only. If you have some body part, focusing on some body part, then you can have focus on that. So that is a waking situation concentration. So that impact to the mindfulness. Mindfulness is, in simple way, is a gentle effort to be continuously present with the experience. Experience can be different. Various techniques are there. Mindfulness means paying attention in a particular way, on purpose, in present moment, and that is non-judgmentally, basically. So non-judgmentally means if you are focusing on thoughts. Sometimes the method is called noting response. Then in noting response, you just label the thoughts, whatever comes to your mind, and you label that. But you should not emotionally attach to that. You should not judge that thought. So that is non-judgmentally, you will focus that part, and you pass through all these thoughts as they come and as they passes during your mindfulness session. So it's a hot topic basically. Mindfulness nowadays, there are lots of session on TED Talk, YouTube, you can search, and you have Scientific American session, have a page cover. Time magazine also have coverage for this. Western world are acknowledging this type of mindfulness and meditation. So basically, are you mindful or mindful? That is very important, and that may distract you during your day-to-day life. In some time, you should focus on your mindfulness also, not mindfully. So regular practice can cultivate three core skills. Core skills like concentration, which we are heard from our school days, like कि प्राणायाम करो या फिर just meditation करने से आपका focus concentration बढ़ता है. So concentration और childrens और जो आप study करते हैं, that उनके लिए काफ़ी फायदेमंद है. So concentration is ability to focus and stabilize one's attention. Sensory clarity is ability to keep track of the component of the sensory experience as they arises in various combination, movement by movement. So you have a sensory clarity by uh, like various thoughts are coming and they goes and the next thought coming to you, so you can focus on that. That is a noting type of technique. Equanimity, basically, this is a you should not attach to that focus thought. Okay? That is unemotional. You should be attached to that unemotionally. Okay? Otherwise, it will fail. Your response will be failure if you do not experience uh, these type of particular thing. So you should be not goes emotional. There are, if you goes in a deep practice, you have various type of emotional changes also. So you can be emotional during that thought process. So you should have practice for that. You should not go into emotional burning to that. Now, mindfulness training technique is basically techniques depend on teachers or some tradition. You can have like various mantra practice, or you can have practice for breathing meditation, or you can just have noting options like which I mentioned. You should focus or note that label that thought. So that is one of the technique. The beginner practice maybe you can start with your diaphragmatic breathing or focus on abdominal breathing. That is also called as belly breathing. Okay, you should sit in a proper silent place. You early in the morning or late at night or whenever the silent situation is there, and you focus on your belly breathing or focus on some other aspects like your eyebrows, between your eyebrows or nose, just upper lip where the air goes in and out. You can focus over that. So that focus of attention is important. So it gives a concentration and it develops strengthen the core skills of development of equanimity also. Equanimity. The intermediate and advanced practice is also there. We just in that is basically done by the monks, and this is choiceless awareness, and they goes into that practice for hours. Okay, so that leads very much of practice. So there are practice like formal and informal practice. You should start with your informal practice so that you can concentrate for 5 minutes, 10 minutes. As practice goes, you can develop your skills. Now, benefits of mindfulness, it changes the brain positive ways. Like there are various brain waves which normally awake or normal person having 15 to 30 beta hertz. Alpha waves whenever you relax or calm or doing some basic meditation techniques. Theta wave, basically this is a deep meditation practice you will have 4 to 8 hertz. The waveform is very much having a low frequencies, and delta head is deep and dreamless sleep. Okay, NRM sleep. So that is different waveforms you feel during your practices during day-to-day life. So meditation basically have theta waves. Also, this right side of the diagram show you the different synchronization practices, like brain waves, how before the practice and after the meditation practice, like it synchronizes the left and right side of the brain, and it creates lots of benefits. So after 15 minutes of meditation practice, after 25 minutes of brain practice, meditation practice can lead to various synchronization of the brain, and the haphazard brain thoughts will be controlled. So basically, our brain is like monkey, actually monkey mind. So you thought so many things. You are doing something and you have different thoughts. What is going on at home or something related to the disease or COVID situation or some environmental factor or political situation. So many things are going on. So your brain is not relaxing basically, and you should focus toward mind so that it can relax. The your both side of the brain should be synchronized while doing these type of practice. Now our brain having this neuroplasticity response also, that is basically changes if you do a long-term practice, our brain circuitry may change according to that. So when you think certain thoughts, it's strengthened, and uh, that neural circuit will be strengthened out, and repeated practice may lead to focus on that. So mental state become a neural circuit. So that need practice. Means if you are doing for just sake of practice, just for sake of enjoyment, like meditation, you are doing for 5 minutes, 10 minutes, and then you forgot. So it will not having an impact. You should practice at least 3 times, 4 times a week, and that goes you into the neuroplasticity state. So self-directed neuroplasticity, like nature has positive state of mind to strengthen and build those neural circuit network. So happiness is makes you the habit in that. So the doing the meditation is you make the habit of happiness, because if you practice meditation, you will feel so many things can be changes into the uh, your stress will be slowed down, and you will feel happy in so many moments of days. The brain is like muscles. If you train that, it will have a response. So it need practice. The meditation of mindfulness also lead to pro-social behaviors like impulse regulation. If you have uh, just short temper, आप बहुत जल्दी गुस्सा आता है, आप किसी भी चीज़ को जस्ट आप किसी पे गुस्सा हो जाते हैं, आप स्ट्रेस किसी पे भी आपको ऑफिस का सिचुएशन है, आप जस्ट आप घर पे जाके उसको निकाल देते हैं. So that can lead to impulse regulation is also there. You will just have a controlled way of responding to various day-to-day stress situation. Emotional awareness is also there. Like whenever you have a response, you will have emotional awareness. Like you watch to your emotions, various emotions like sad emotion, happy emotions. So you can aware of that emotions and you will focus on that. Compassion and empathy is also developed with the practice of mindfulness. Forgiveness is also one of the factor which developed by long-term practice. You have must seen have Buddhism, they have this sort of behavior. Um, there is also a country that is having the highest happiness index. So that is Bhutan, which is having a happiest country in the world. Why? Because they do these type of practice like mindfulness, meditation in their day-to-day lives. Their culture is like that. Relaxation response is also developed. It is the physical state of deep rest that changes the physical emotional response to stress, and the opposite of the fight and flight response. So various systems are come into play, like release of endorphin, relaxes the muscle, increase circulation, elevate the oxygen, as a buildup of enzymes, release toxins, healthy growth. So there are various aspects by which your immune system is stronger. So not only exercise, if you do just exercise it will help, but if you do meditation with exercise or mindfulness practice with exercise, it will have a immense role. Now, to summarize the mindfulness or meditation practice, having mindfulness, it increases in your day-to-day of observing and attending to the experience, acting or awareness will be improved. There will be reduced functional, mechanical or automatic pilot response. Like you are doing your work like automatic, you are not aware of that. So there are so many aspects. Now, getting carried by the thoughts or feelings, overwhelmed by pain and thoughts. The well-being, in the well-being, you can have change like increased well-being, satisfaction of life, feeling of life activity, overall happiness, kindness to self, reduced self-judgment, sense of location will be reduced. So like that, you have a good human being responses also. And reduce the stress, there are reduced perceived stress response by doing this practice. Awareness of stress triggers, toolkits of methods to manage the stress and improve quality of life. So you can develop that practice. Improve coping with work environment and workplace pressure, relaxation about the wider changes and ability to focus on own work, and also perspective taking means perspective take is basically what other things you should know. That person, if he asking you address, you want to go somewhere in your colony, so you can help them. How how you perceive that problem, and you just left, right, go there, and there is a landmark. So you feel, in that way you can just the some other perspective you take and you explain to them. So in that way also you have there are so many examples of this. So you feel other person emotions and you react to that. So that is a summary of these mindfulness practice. So let's practice. But before, just one of the some tips, like you should, before doing this practice of meditation, you should have a peaceful area, calm or relax, where you can relax properly. You should always sit, okay, not lying down. If you lying down, but make sure that you should not get sleep into that. So that it's a very common practice that if you lie down, you get into the sleep. So you should not sleep during the practice. So the best position is chair sitting or just cross leg sitting, like Padmasana or Siddhasana, in which you can support with the cushions also. If you have pain, uh, the spine should be erect. So that is the basic thing, and you should be very much balanced. Okay. Then scan throughout the body and release unnecessary tension. Your shoulders should relax. Okay, your shoulders should relax. 1 minute. I just okay. So bring attention to the body. Various parts of the body you can attend. Tune into the sensation of your breathing. Like you can focus to the belly breathing, or just I told you to focus on your upper lip, the how the air goes in and out, or the center of the eyebrow. So various aspects you can, or any part of the body you can concentrate. Your mind may wanders, so you should notice that your mind is wandered, and you have to take your attention back to your breath, what or whatever you focus is on your body. So uh, your mind should not get distracted. If get distracted, then you should notice that and keep it awareness towards your body part or breath. So first practice, you can have 5 minutes, 10 minutes, you can gradually increase. Directly if you go into the 30-minute session, it will be very hectic for you, or you will not enjoy that. If you practice for 5 minutes, then you have feeling of that, yes, I have achieved something. So that practice lead to a good response. So we will have a audio here. Uh, I want all the participants to please focus and do at least for this 4 minute. This is a 4 minute video on which you can do it on your own. That will help you how you can have this practice. Okay.
Belly breathing. In this mindfulness practice, you will learn a deep breathing technique. Sit on the floor and cross your legs, or sit upright in your chair, whichever your teacher prefers. Everyone take a deep breath in. Did your shoulders rise and your chest go out? This is most people's response, but it is incorrect. When we breathe in deeply, our shoulders should stay still and our stomachs should go out. This is because our diaphragm, a muscle under our lungs and above our stomachs, flattens and pushes out our stomach area, which is why we call it belly breathing. This is how singers and actors breathe to use their voice properly. Belly breathing instantly increases the amount of oxygen in our bloodstream. It calms our nervous system and releases feel-good chemicals into our bodies, so it is a key part of mindfulness. So, let's begin. Put your hands on your belly. Imagine You're filling the balloon up with air and making your belly blow up. Breathe out and let the air out of the balloon. Your belly should go in and your hands go down. Let's repeat that. Breathe in through your nose, fill the balloon up with air. Now breathe out of your mouth, let the air out of the balloon. Let's keep going. In through your nose. Now breathe out through your mouth and flatten the balloon in your stomach. You shouldn't hear your breath go in. If you can, this means you're breathing too quickly. Breathe in and blow up the balloon. And breathe out again. Keep your back and your shoulders still. Nowhere apart from your stomach and chest should be moving. Breathe in and breathe out. In through your nose and out through your mouth. Breathe in and breathe out. One more time in and last time out. Well done. Don't worry if you found this challenging. It will take a lot of practice before deep belly breathing becomes natural and easy. You should now feel relaxed as you have increased the oxygen into your bloodstream, calmed your nervous system, and released lots of feel-good chemicals into your bodies. You can do your belly breathing at any time, in any place. Even a couple of belly breaths will calm you down, wherever you are. Try it whenever you next feel worried.
Okay, so I hope you enjoyed this session. What is the next step? That is last slide. Actually, you should regularly practice this. So that is the most important thing, the mindful